Wonderful. So Maria and Stephen, thank you so much. If you could hang in there for questions, that would be fantastic, because now I would like to turn the call over to the founder and CEO of AZZLY, Coletta Dorado. Coletta?
Great. Thank you, Derek. Great job. And Stephen and Maria, so wonderful to have you on. Really appreciate your participation, both of you. It's amazing. There's 153 million people living in areas that can't get the healthcare service that they deserve and that they need. So telehealth is growing exponentially, and we're really pleased to be part of that partnership with Zoom to bring telehealth to more and more treatment centers throughout the United States. So really appreciate this partnership. As far as questions, Derek, you monitor Q&A in case anything does come in, but
Sure.
We did get some really great questions in advance. And you know, HIPAA obviously is very important, as both Stephen and Maria know, in the healthcare arena. So the question is around acceptable virtual formats that use and that are HIPAA approved. So Stephen, any comments in regard to that as far as what Zoom follows as far as strict HIPAA compliance?
Yeah, absolutely. Well, you know, the first thing is that we always sign a BAA with our partners who are building on our platform. So we want to make sure that there's some peace of mind there, and that, you know, our entire infrastructure is, you know, HIPAA ready and HIPAA compliant, so that, you know, when our partners do build on it, you know, they have all the tools that they need to likewise be compliant with whatever laws that they need to meet.
Yeah, great. And Stephen, you mentioned it earlier, 2020 was a rough year. It was an explosive year with COVID going on, and you're focused on security. We stood by and watched. Being an electronic medical record, we erred on the side of caution. Our partnership with Zoom, even though we use you as an organization, we did not embed you in our electronic health record. You've proven to us through, you know, all that you've done towards security, privacy, your features, your functionality. I mean, the feedback we get, there isn't a platform that's as strong as Zoom, and love the fact that you are a verb. Says a heck of a lot. So Maria, as far as the features that you're impressed upon that you've seen in Zoom since we embedded it in AZZLY that really follow along HIPAA lines.
Absolutely. So allowing attendees, or I'm sorry, hosts, I should say, to mute attendees or to remove someone if needed, if there was anything inappropriate. Having the private waiting room to ensure that only those who should join are able to join the meeting. And then, of course, you know, Chloe, we also, just going back to the virtual formats, we strongly encourage, we train our users and hope that they'll pass it on to others, you know, to just watch out for their own privacy. You know, don't launch the meeting in a public place. Make sure that you have a private space or an office where you're meeting, so that your meeting, because it is in a telehealth format, is kept private as though it would be in an office environment.
Great, thank you. So another question that came in, Maria, was about, you know, many times a telehealth session is started and a family member, the provider would like to have a family member join that they hadn't invited. How easy is that to do?
Great question. I did demo this a little bit earlier, and so we're not limited on that, but within the Zoom meeting itself and the attendee list, you can actually click invite, and there are a few options that are offered. You could either select to email directly. So if you already have an email configured within your system and you want to launch directly from there, you can. You can also copy the meeting URL so that you can paste it, whether through email or text, to someone else. You're also able to simply provide that meeting ID if someone called and they said, hey, I'm trying to join this meeting and it's asking me for a meeting ID. So you have multiple ways that you are able to include others. But again, they will be kept in a waiting room until both the provider and the patient are ready for them to be admitted.
Got it, got it. A question just popped up. I see, are BAA agreements free? I will share that as a partner of Zoom, it is bundled in our pricing model. being a partner of Zoom. So the BAA, we have BAAs with all of the clients that use our subscription services, use AZZLY Rise. We have a BAA with them. AZZLY has the BAA with Zoom, so that umbrella of a BAA protects all of our users. Stephen, you want to comment at all about that?
No, I think you got it right on the head.
Okay, wonderful, great on that. As far as Stephen, what security does Zoom have in place to prevent unauthorized attendees from joining? I know in 2020 there was a lot going on with that. What has Zoom done to prevent that from happening again?
Yeah, for sure. So, in 2020, we focused on end-to-end encryption first and foremost, right? With full 256 GCM encryption for all our meetings, right? Highest levels of security across any platform that you'll see. I think a lot of the, instances of, unfortunate instances that you maybe see in the news are from people sharing out their link to an actual meeting.
Sure.
So, with our partners, right, we have certain APIs and capabilities that allow you to set up meetings and join meetings without even having to send out a link or having to share that out, right? It can be a click of the button, it can be account unaware for folks to join in. We also introduced different tools like just managing users in general, being able to kick them out more easily, the waiting rooms where you can admit the people that are supposed to be there and not let the other ones in if they don't seem familiar. But I think a lot of it has to do with just protecting those meeting links. The rest of it, we've done our best to make as secure as humanly possible, and we continue to find other ways to make it even better.
Excellent, great. As we're close to our 2:30, our 30 minutes, one last question for you, Stephen. Is healthcare becoming a growing piece of Zoom's overall business?
I would say it's a huge part of it today. We have our own dedicated healthcare teams that are out there focused on working with providers. We have a very large ecosystem of great telehealth partners that are powering their platforms with us, and we see it as also transformative industry, right? That won't be going back to all in person once everyone has experienced that convenience through platforms like AZZLY, right? So, unlike other industries like education, where you see folks, going back to school in person, that make more sense to have that in-person engagement. And a lot of these telehealth sessions, where, to your point about people being in geographies that just don't have good access to good doctors, right? This makes a lot of sense to continue to expand on this in terms of an industry, and I think it'll help improve a lot of outcomes as well. So that's why we're focused on healthcare as an industry in general.
Excellent. Stephen and Maria, thank you so much for today. And Derek, as moderator, really appreciated your participation. We're thrilled to be a partner of Zoom, and we look forward to sharing and educating more and more providers out there of the ease of use, the reliability, security, privacy. It's bundled, it's packaged well, and it's proven itself to really help in the healthcare, especially when it comes to HIPAA, meeting HIPAA demands. So thank you for all the efforts, and thank all your cohorts behind you. If anyone is interested in learning more about telehealth and reimbursement side, we want to invite you to join us next month for our Telehealth RCM webinar. That is scheduled for April 20th at 2 p.m. Eastern time. There is an Eventbrite link that will be shared. Please add us to your social media, follow us. We really appreciate your taking the time today in attending and joining. Please give us feedback if there's anything that you want to hear or see or learn about that we can assist you with. We're planning to do these webinars at least once a month. So again, thank you all. Thank you, panelists. Thank you, attendees, and have a wonderful rest of your day.
Thank you.